Assalamu alaikum student. Today I am going to discuss about the anatomy of the bony pelvis, and I am making this video I am making this video on demand of some students. And now, what is pelvis? Pelvis is basically a bony structure. It is basin-like in shape. It like inferior to the abdomen, and it connects the trunk to the abdomen. There are basically two types of pelvis: the false pelvis and the true pelvis. The false pelvis is a part of abdominal cavity, while the true pelvis is not a part of abdominal cavity. It basically separate the abdominal cavity and it is a demarcating point between the abdominal cavity and the lower limbs. It connects the abdominal cavity with the trunk, or the upper extremity with the trunk. The trunk with the lower limb. It connects the trunk with the lower limb. Now, the true pelvis is basically made up of bones, vertebrae, and bones. There are basically two hip bones. There are basically two hip bones, sacrum and coccyx. Two hip bones further consist of three bones: the right and the left hip bones. Each of the hip bone consists of ilium, pubis and ischium, and the sacral bone further consists of five fused sacral vertebra, while the coccyx bone vertebra consists of four fused coccyx vertebra. It has four fused vertebra, while the sacral bone has five fused vertebra. And now we are going to discuss those vertebrae. This is basically the pelvis. In this pelvis, these are basically the hip bone. This is one hip bone, this is the second hip bone, and this hip bone is further consist of ilium. This is the pubic bone, and this is the ischium bone. This area is called the sacral bone. This area is the sacral bone, and it consists of five fused vertebrae: one, two, three, four, and five. It consists of one, two, three, four, and five. This consists of five fused vertebrae. This is the coccyx bone, and the coccyx bone consists of this area is the coccyx bone, and it consists of four fused vertebrae. The upper border of the one sacral vertebra, the S1 vertebra, the upper border of the S1 vertebra is invaginated inward, or there is a deep notch in the body of the upper border of the S1 vertebra, and this area is called the promontory. And laterally there are two wings of the sacral vertebra 1. There are two wings of the S1 vertebra, and these wings are called the ala of the sacrum, or the wings of the sacrum. Above, this is the base of the S1 vertebra, and this base basically articulates with the lumbar vertebra. Above there are lumbar vertebra. There are lumbar vertebrae, and the base of this sacral vertebra 1 articulates above with the lumbar vertebra, and below with the sacral 2 vertebra, and the whole sacrum below articulate with the coccyx bone. And in this ilium bone, this is the anterior superior iliac spine. This rich shape area is called the iliac crest, and posteriorly is the posterior superior iliac spine. It has a fossa. There are two fossas on both sides. This is called iliac fossa. This is called iliac fossa. Now, the pubis bone, the two hip bone meets with each other at symphysis pubis. They meet with each other at symphysis pubis. This is one pubic bone, and this is second pubic bone, while this is ischial bone. This area is called the pubic crest, and the raised eminent, or the prominent area is called the pubic tubercle. While from the pubic tubercle there is a straight line going upward, going posteriorly and upward, and this line is called the iliopectineal line. This line is basically continue with another line which is called the arcuate line, and arcuate line is then continue continue with the upper margin of the sacral ala. This is the elum or wing of the sacral bone, and the margin of this wing or ala of the sacral bone is basically continue with the arcuate line, and arcuate line is basically continue with the iliopectineal line. This is the iliac crest. This is the this is the pubic crest. This is the pubic tubercle, a prominent crest area, and this continue with a line called the iliopectineal, a straight line called the iliopectineal line. The iliopectineal line continues with another line called the arcuate line, and this arcuate line then continue with the margin of the with the margin of what, with the margin of the ella of the sacrum, and then this margin of the ella of the sacrum basically continue with the promontory of the sacral vertebra. And in this way, here is the margin of the sacrum, the arcuate line, the iliopectineal line, the pubic tubercle, and the pubic crest, and this whole rounded area is basically called the pelvic brim, or we can in other words we can say as the pelvic inlet. This pelvic inlet is a landmark which separates the true pelvis from the false pelvis. Above this inlet is the false pelvis, while below this inlet is the true pelvis. Why this is called the false pelvis? Because anteriorly it is deficient. It is not a cavity. It is deficient. It is posteriorly lined by the lumbar vertebrae, laterally lined by the iliac fossas, but anteriorly lined by the lower anterior abdominal wall. This area above this pelvic brim, there is another cavity called the false pelvic cavity, which is lined posteriorly by the lumbar vertebra, laterally by the iliac fossa, and anteriorly by the lower border of the anterior abdominal wall, by lower anterior abdominal wall. Now this is the basically the superior ramus of the pubic bone, and this is the inferior ramus of the pubic bone, and this region is called the ischial bone, and this raised area in the ischial bone is called the ischial tuberosity. This is the ischial bone. Up to this region, this is the ischial bone. This area is called ischial tuberosity. This prominent area of the ischial bone is called the ischial tuberosity, and this is the inferior ramus of the pubis bone, and this is the superior ramus of the pubis bone. This ridge is basically the ischial spine, and it is very important in gynecology. It is used to assess the station of the patient, the station of the baby head. When the baby head is above this ischial spine, we say that the station is in negative value. But when the baby head is 1 centimeter below or 2 centimeter below of this ischial spine, we say that the station is +1 or +2. This is palpable by the vaginal examination. Now this area is called the acetabulum, formed by the acetabulum. In this acetabulum, basically the head of the femur articulate, and these foramens are called the obturator foramens. These two foramens are called the obturator foramens. Now there are some joint in this pelvic cavity. The joint first of all, the joint where the two hip bone meet is called the symphysis pubis. First of all, this is the connection between the two hip joint, which is called the symphysis pubis. Then there is connection of the hip joint with the sacrum. This is the hip joint. This is the hip joint, and it is connected with the ella of the sacrum, and this joint between the hip bone and the sacrum is called the sacroiliac joint. This is the sacrum and this is the ilium, so the joint between the sacrum and the ilium is called the sacroiliac joint. There is a connection between the sacrum and the coccyx. Coccyx consists of 4 fused vertebrae, where the sacrum consists of 5 fused vertebrae, and there is a connection between the sacrum and the coccyx, and this connection is called the sacrococcygeal joint. This sacrum is connected with the base of the sacrum. The base of the S1 vertebra is connected superiorly with the lumbar vertebra, and the joint in this region is basically called the sacrolumbar joint. So there are basically four joints: sacrolumbar joint, sacroiliac joint, sacrococcygeal joint, and symphysis pubis. There are four joints in this bony pelvis, and there are three basic bones: the hip bones, the coccyx, and the sacrum. And there are some landmarks which form the pelvic brim. We have discussed all these things, and now we are going to see it from this sketch. Joints with the two hip bone meets at the symphysis pubis. The connection between the hip bone with the sacrum is called the sacroiliac joint. The connection of the sacrum and the coccyx is called the sacrococcygeal joint, and the connection between the sacrum and the lumbar region is called the sacrolumbar joint. Now, pelvis brim basically divides the pelvis into two parts: the false pelvis and the true pelvis. The false pelvis is anteriorly lined by symphysis. Sorry, I have made a mistake here. This is not about the false pelvis. This is about the pelvic brim. This is about the pelvic brim. The false pelvis is anteriorly lined by the lower anterior abdominal wall, laterally lined by the ella of the iliac fossas, and posteriorly lined by the lumbar vertebrae, which we have already discussed. Now, true pelvis start from the pelvic brim. Pelvic brim is also called the pelvic inlet, and the pelvic inlet is anteriorly lined by the upper margin of the symphysis pubis, the sacral promontory, posteriorly by the sacral promontory, and laterally by the ilioepithelial line, as well as the arcuate line, as well as the margin. This pelvic inlet is lined by the margin of the sacrum, the arcuate line, the ilioepithelial line, and the upper margin of the symphysis pubis. And some landmark of the pelvic brim are these: sacral promontory, sacral ala margin, arcuate line, pecten pubis, pubic crest, and symphysis pubis. Now we have discussed about the anatomy of the pelvic inlet, and now we are going to discuss about the anatomy of the pelvic cavity and pelvic outlet. The pelvic cavity is anteriorly lined by the body of the symphysis pubis, which is also called the medulla. This is the body of the symphysis pubis, and the inner aspect of this area is called the medulla, and this medulla lined basically the pelvic cavity. Laterally, it is lined by the pubic bone. This is the superior ramus of the pubic bone. These are the superior ramus of the pubic bone, as well as the ischial bone inner aspect. There is ischial bone. The inner aspect of the ischial bone also line the pubic bone, superior ramus and inferior ramus. The superior ramus and the inferior ramus, the inner aspect of this superior and inferior ramus basically line the inlet cavity, and the inner aspect of the ischial bone also line the pelvic inlet cavity, and posteriorly it is lined by the second and third aspect of the sacrum. Second and third vertebra of the sacrum basically, or the sacral bone basically line the pelvic inlet. First, second, and third. First is basically line the pelvic rim, and second and third line the pelvic cavity. So the second and third sacral vertebra line the pelvic cavity, as well as laterally it is lined by the pubic bones, the inner aspect of the pubic bone, and the inner aspect of the ischial bone, and the inner aspect of the ilium bone, and and anteriorly it is lined by the medulla of the symphysis pubis. The inner aspect of the ilium bone, the pubic bones, and the ischium bone basically lines the pelvic cavity. Now, the pelvic outlet is lined by the anteriorly by the lower margin of the symphysis pubis, laterally by the ischial tuberosity and sacrotuberous ligament, and descending ramus of the pubic bone, and posteriorly by the piece of the sacrum. the last vertebra of the sacrum, the last vertebra or the piece of the sacrum, and the lower margin of the pubic bones, the lower margin of the descending, this is the descending ramus of the pubic bone, its lower margin, and this is the ischial tuberosity, its lower margin. In this the ischial, the pubic bone lower ramus and the ischial bone lower margin line laterally the pelvic outlet. The pelvic outlet is laterally lined by the lower margin of the ramus of the inferior ramus of the pubic bone and the lower margin of the ischial tuberosity, and posteriorly it is lined by the sacral, the piece of the sacrum, and anteriorly it is lined by the lower margin of the symphysis pubis. This is basically the pelvic outlet in which the AP diameter is more, which is about 13.5. The AP diameter here is about 13.5 and the transverse diameter is 11. While in the cavity, both the diameters are same. While in the inlet, the transverse diameter is greater, that is 13.5, and the AB is smaller, that is 11 centimeter. Thank you. If you like my video, please subscribe my channel.